Hi, this is Dr. Bhargav, Consultant Pediatric Dentist, SPARSH Hospital, Yelahanka. So today we are going to talk about one of the oral habit in children, that is thumb sucking. So why do children keep their thumb or finger in the oral cavity? So this develops because of a sense of insecurity. So the major etiological factor for this thumb sucking is uh, stress or hunger, or even a working mother whose the mother's attention is less towards the child, or over abusive parents, etc. So what happens when the child places the thumb or the finger in the oral cavity? It gives a sense of pleasure or happiness for the child. So that is the only reason the child keeps the thumb in the oral cavity. So is this habit normal or abnormal? This habit is normal up to the age of 3 years. Beyond that, this habit is considered to be an abnormal activity. So what happens if the child uses the thumb or finger for a prolonged period of time? So there are different deformities that can form in the oral cavity as well as the facial profile. So let us consider as two different aspects, that is extraoral deformities and intraoral deformities. In extraoral deformities, it is you can check with the fingers or the thumb which the child uses to keep in the oral cavity. It will be like more clean, and it appears more red, and there will be a callus formation on the thumb if the thumb is coming in contact with the teeth. And also the facial profile will be more convex or sometimes even flat. So coming to intraoral examination, the intraoral features will be like there will be a most evident prognathic maxillary teeth and retrognathic mandibular teeth. That is because of the thumb which is placed in the oral cavity, it goes and rests over the hard palate. So this gives a pressure over the hard palate to make that upper arch more constricted, and this can even lead to crossbite, that is posterior crossbite. So how this habit can be prevented? This habit can be prevented by engaging the child into more of physical activities and mother giving more attention towards the child. And what are the other therapies that can be used? So there is removable and fixed mechanotherapies. That is, removable is an appliance which is given to the child, which is placed in the oral cavity, which is also called as palatal crib, palatal rakes. This makes the child reminds the child that the habit has to be avoided or it has to be quit. And this is in total control of the child because it's an removable appliance. The child can always remove whenever it's feeling it's not required. So the other fixed mechanotherapies are the bluegrass appliance and the quid helix, which is placed and bonded over the tooth, where the child will not have any control over the removal of the appliance. And apart from this, there is another therapy called Dunlop's beta hypothesis therapy. This is like making the child sit in front of the mirror and intentionally make the child perform the thumb sucking habit. So what happens? The child will feel more conscious and gradually it will quit the habit. Thank you.